Give patient your time. Listen to them, let them talk, give them the commitment of your. See, they are spending their money to see a doctor. Giving them the best option that is possible, internationally possible. Why not? People have recognized us, seen us, identified with us, and I believe the trust is growing. Thank you so much, and thank you for giving us this platform also to talk about Unico Hospital and this journey. So, 1 year has been very eventful, as in we've grown, you know, every month it's been a new experience, and our patients also have a certain expectation from us, and we also hope that we are able to fulfill those expectations. We are here on a road, Green Road, which is more like the health hub of Dhaka city. We've got so many hospitals around us, and yet in this 1 year, people have recognized us, seen us, identified with us, and I believe the trust is growing. So in the last 1 year, we've seen more than 10,000 people have actually come to seek healthcare at our hospital, and we hope that they have all gone away happier than they came in. Yeah. See, when they know that there is an Indian management here, that they assume there is an Indian management here. But the truth is that the Indian hospital, Rajagiri from Kerala, is actually the technical consultant. So we were here to set up the institution, do the designing, planning, the equipping, and all of that. So we've set up the institution, and a few members, like the nursing leadership, comes from Kerala. I and another, the operation theatre manager also comes from Kerala. Few of us only actually come from Kerala. The rest of the team is Bangladeshi. But when people hear that, from when patients hear that it's from somebody from Kerala is here, they assume that we have Indian doctors or foreign doctors. But I'm very proud to also say that we don't have any foreign doctors here. We have only Bangladeshi doctors, but our Bangladeshi doctors are outstandingly good. And if you ever interacted with any of them, you'd see how compassionate they are, how committed they are to their patients and to that the healthcare delivery process. So I would say that's something that a lot of patients find new, refreshing, because Dhaka healthcare is a very busy system, right? Extremely busy system, and most of the times I've heard patients tell me that in many hospitals, doctors don't have the time to listen to them. Whereas here, that is the one thing we ask our doctors to do. Give patient your time. Listen to them, let them talk, give them the commitment of your. See, they are spending their money to see a doctor. We also need to be, giving them their due, right? So our doctors are always encouraged to listen to their patients, prioritize the patient. Simple as that. Do what's best for your patient. I think that's something I tell all our doctors all the time. Do what's best for your patient, and that's it. That's all we ask of them. So I think that is something that a lot of my patients have personally told me, that they are very surprised to see how much time doctors actually spend listening to them and talking to them and hearing them out. I think that's probably one of the biggest points that I have. Yes, responses I've got. And another really sweet thing I hear very often is that they tell me they've never seen housekeeping staff smile in a hospital, whereas here you see, yes, they are greeting you, they are smiling, they are walking around the corridor doing their work, but they say assalamu alaikum, and they feel nice about that. And I think that goes to show about the kind of culture that we are trying to develop here inside the institution. And I would say that is something our patients give a good feedback about, and that does make me feel good. Yeah. I would say we have a fantastic team here on board, And I would say my team is my greatest asset, right? Whether it's my clinical team, my technical team, my nursing team, even my management team here, whether we're talking about our finance or the HR, even the supply chain, the team that we've put together, I think that's our greatest strength, because the doctor alone is not able to, render the best service. He or she is very good at the clinical side, but the nurse has to be as good to take care of their patient, right? Because the doctor is not going to be standing by the patient through the journey. They are there, they give the advice, they give the prescription. The nurse and the others in the team and the system also really need to contribute to make that patient's journey a memorable one, a beautiful one, right? So the entire team, I guess, is my greatest strength, and I think that is what I would be most proud of. The team that we have at Unico, we call ourselves we are a family of caregivers. That's how we put it. So I would say we are very fortunate that in this 1 year of our existence, we have been able to introduce very specialized services like minimally invasive cardiac surgery. So when you hear cardiac surgery, normally you will think of the chest wall being opened out and the cardiac surgery being done. However, here we have specialists who do minimally invasive, as in the wound is probably just 2 to 3 inches only into to maximum 3 parts of your chest, very small incisions, and they are able to do the surgery, if the patient is fit for that kind of surgery, of course. But we do have that capability, and we are already doing minimally invasive cardiac surgeries here. So I would say that is a department that we will continue to encourage and develop. And we are also doing a number of congenital cardiac corrections, like ASD, VSD corrections are being done here on a regular basis. A lot of children are getting cardiac surgery help from our institution at this point of time. So we will continue developing the cardiac surgery wing, and of course interventional cardiology is also there to support. And even in interventional cardiology, there are procedures, very high-end procedures, wherein we use the intravascular ultrasound and intravascular lithotripsy to do procedures. So those again are very rare combinations. We are doing procedures of that extent as well. We also have interventional neurology here. Again, very few institutions in Bangladesh have interventional neurologists on the team and doing high-end procedures, so that is also there. I would have to talk about our radiology department as well, because our team of radiologists and technologists, the combination is very important. So the technologists are able to do certain scans which are very rare in Bangladesh, in fact, not commonly done. And we do have that level of expertise with our MRI and CT machines. And of course, it's not just the machine alone, it's the man behind the machine, the technologists who work behind the machine, and the radiologist who actually read the visuals that are there. So that entire team together is also one of our greatest strengths. So these are some of the areas that we right now have established, and we want to be able to encourage that. Interventional radiology will be an area that we are going to be very keen to work on and introduce, into the country. And of course, as we move on, when we see there are specific areas that can be explored, we would love to explore that as well. Yes. So currently, we are going to be a 250 bed. Currently, we are at 120 beds, and the growth is, of course, steady growth. We are looking at growing this institution. Hopefully, a few years down the line, we are also looking at having a College of Nursing, an institute for nursing training, because we see that nursing care is again one of the areas where there is a lot of scope for improvement, because bedside nursing versus the theory part of nursing is actually very different. So you need to be strong in theory, but bedside nursing care is something that we feel we have a lot of scope to improve. So definitely there will be a nursing college in the plans in the coming years. And but right as of now, I would say developing the hospital as such, developing the outreach programs of our hospital. For example, we have Unico home care service. Okay, so I know a lot of hospitals have home care wherein you will do blood sample collection, you will do home delivery of drugs, and maybe even to a certain extent some nursing care is also given. Not emergencies. So emergencies cannot be handled at home that way. But we are having a doctor-led team. Wherein a doctor will also go to the patient's home, our family medicine team, family medicine doctor and team, the team of doctor, nurse, and whoever, sometimes physiotherapist also go. So the team goes into the patient's home and does the assessment of the patient. Particularly, if a patient is in the geriatric age group, senior citizens, they are not able to actually travel to the hospital, but they need to be regularly maintained. Their health has to be checked up every month just to make sure that everything is okay with them. So, or if someone has had an injury, an orthopedic injury, a fall injury, is immobile for some reason, they cannot travel to the hospital. At a first step, our family medicine team will go to the house and we will do the initial set of care. And of course, we also have telemedicine. So from there, they can always consult with our doctor here as well if a super specialist is required. But developing the home care program, and of course, our institution will be the primary focus for the first 3 to 5 years, for sure. Right. So we have over 500 team members right now here, colleagues here. Out of that, around close to 100 of them are doctors, and some of them are consultants and senior consultants. The others are specialists, registrars, medical officers, senior medical officers. But this is our whole team now. Yes. Yes, there are a lot of healthcare providers, no doubt. But I would say for us, the service element would be our, greatest focus point. And the training and development that we do in-house constantly to enhance our clinical nursing and our entire technical team here, I think those would be areas that would make us really different. Because right now in the 1 year, within this 1 year, we have already done 2 international nursing workshops. Okay, we've had radiology workshops, as in for technologists. Even laboratory technologist workshops have actually happened. These are national level workshops we are doing. Our latest nursing workshop was on critical care nursing. Right, so again, these are not very commonly done. Radiology technologists don't have too many national level workshops here, but we have fantastic response. I would say training and development of our entire in-house team so that we offer the best to our patient, because healthcare is constantly developing, and we need to develop our team members. Our manpower also has to develop in terms of their clinical know-how, in terms of their technical know-how, so that they can offer better service to the patient. Right? What was best for the patient 10 years ago is no longer the best option. We have multiple options available. But how would you make an option available if you didn't know about it? Right? So I would say that is one of the areas we focus on a lot, and the service element is one aspect that we focus on. Yes, definitely we are able to give good care, but to make them feel good. Because hospital is a place of healing. It's not necessarily just treatment alone, right? It's a place of wellness. It's a place of healing. So, and we want to be able to treat them. See, when you go, I have heard a lot of patients tell me that when they go to Singapore, they get a wow factor there, right? They feel good because the hospital itself looks good, maintained good, clean toilets, clean corridors, people smiling, people greeting. Why can't we do that in Bangladesh? It's very much possible. One of the focus areas, thank you for putting that perspective in. One of the focus areas that we have here is prevention of disease and promotive health. Okay, very recently, just yesterday was World Brain Day, and we introduced a mascot named Stro. I don't know if you saw Stro. Stro, Stro. So Stro is a mascot that will make people aware about the symptoms of a stroke. Okay, simple 3-4 things. We tell patient to smile, to talk, to raise their hands. That's why STRO, smile, talk, raise hands, and observe. If the patient is unable to do any of this, after they've had an episode, of unconsciousness, or they've fallen down, we let our patients know. We give them an awareness, right? So that awareness comes only when we talk about it. We have to make the public aware about a disease condition so that they can start taking better care of themselves, correct? So information about a health condition, how you can prevent it, how can you stay healthy, how can you stay well, that is an area we focus on a lot. So promotion of good health, preventive medicine is an area that we focus on a lot. And if you see any of our promotional videos, you will find a doctor talking to patients about how to maintain wellness, what is a condition, how can you avoid it, what are the things to do. That's how we try to encourage good health in the community. So I would say that also is a differentiating factor for Unico. Yes. So when we did, I told you, Rajagiri was involved in the planning stage, in the final execution and commissioning of this project. So Rajagiri Hospital itself is a JCI accredited hospital. And over the past years of experience that I've had, I've worked in both JCI and ACHSI accredited organizations. The ACHSI is the Australian international accreditation, while JCI, is the American accreditation council. So with experiences of both these, all our planning, right from the entire layout planning, people movement, everything has been done with that concept in mind, right? So even when we do our registration process, maybe you have noticed we are more digital than a lot of other hospitals. So your patient reports, you will get it on your patient portal, your OP summary, you will get it there. So all our planning has been done in a way that we will definitely be going forward for accreditation of any international organization. It could be JCI, it could be ACI, or maybe ACHSI. But we are planning to go ahead with the accreditation, and hopefully this year itself, now that we are in the second year of operations, we will be applying for the international accreditation. Yes, so a lot of our processes, our clinical protocols are based on these international practices. And as much as possible, with whatever know-how we currently have, the entire team together, we try to adopt these international clinical best practices into our daily service routine. I think I already answered that earlier. So training and development is one of our mission statements. So whether you are a doctor, you are a nurse, you are a technical person, you are a non-technical person. Even I attend training programs from time to time, because all of us need to constantly keep updating ourselves and knowing what are the best practices in the industry. So there is no compromise in that area, whether we are hosting the training workshop, or whether we are attending a workshop elsewhere, or whether our doctor is going abroad to attend a training workshop. All of these are equally encouraged. We want our team members to constantly upgrade their knowledge so that we offer what's best for our patients. So yes, training and development is a top priority in Unico Hospital. So when we started off this project here, when Rajagiri Hospital, in 2022, when we stepped in and we came in to start the project, the nurse leader who was here was sent to Rajagiri for a month-long training. Our F&B manager has been sent to Rajagiri for training, and the nursing leadership of Rajagiri Hospital was here for 1 year training all the nurses who were in the first bundle. And even the nursing leadership who is here today, she has also undergone training at Rajagiri Hospital. So this is a constant program. And again, we are also considering if some more of our team members, because the visa process was a little hindered for the last couple of years. But since now again that option is open, we are considering sending some of our other specialists also to India for training. Most probably it will be at Rajagiri only. We are trying to get the training happening. And we will also be looking forward to some very specialized doctors coming here to train our local team as well. Yes. So, like I already told you, when we identify the outsourcing facility, it's most likely for lab only, because radiology, in fact, we are stronger than a lot of other hospitals, our team here. But for lab, when we do this kind of outsourcing, again, it is a accredited lab that we approach or we onboard, so that there is an external measure also already in place to ensure the quality of the results. And of course, timely delivery of those results, we have to constantly follow up. And there are times when, it's all machine dependent. So sometimes the machine does break down. There will be a delay. In such cases, we also have to apologize to our patient and let them know that there has been a delay in the lab test. Yes, but we generally try to stick to our report delivery times. So they go abroad seeking what? They go abroad seeking a trustable, reliable, environment, right? The doctor, of course, the nursing care, the entire environment has to be, giving forth a level of trust. They should be able to trust the system. And what we are trying to do here is also something similar in those lines. When you walk into our organization, into our hospital, you will see that uplifting environment here. When you interact with our doctors or our nurses, you will see that caring attitude coming through, right? And when you speak to our consultants, the time that they spend with you, listening to you, talking to you, making you understand each aspect of your condition, I think that is a step towards building that trust. And I'm also happy to say that, as an Indian, other Indian friends also know me, and therefore they refer some of the patients who are seeking, wanting to seek treatment in India. So I've had few cases being referred to us wherein they were planning to go to India, and they go approach one of my Indian friends, and then my Indian friends say, no, why don't you try Unico? And they do come here, and we are happy to say that they have had a good experience, and they are talking about us to other friends and relatives, and we are getting patients coming seeking that level of care from us. And yes, of course, that's why we are all here. We have to have a healthcare delivery system that meets all their needs within the country, right? Of course, to a certain extent, there will be some people who still continue to go abroad, but there is so much of a lack of healthcare systems in place in the country for the kind of population that is there, isn't it? And most of the healthcare systems are located in Dhaka. Yes, it's highly centralized. So while we have a lot of other districts where the same level of healthcare delivery is required, this same level of accessibility to healthcare is required, right? So definitely there is no dearth of patients, but again, giving them the best option that is possible, internationally possible. Why not? When we have our doctors here in Bangladesh, the doctors I have met are as good as any international doctor, right? But we need to also be able to give patients that little bit of extra care, attention, time, and build that trust in the patient's mindset. Our technology also here, so I should tell you, the CT that we have here, our 128 slice CT, the Somatome Exceed, in fact, it was the first in Asia when we bought it. Okay, So the MRI we have, the cath lab that we have, the Philips unit that we have here for the cath lab, it's the latest that they have to offer, right? So technology-wise, we are nowhere behind. Clinical expertise, we are nowhere behind. Yet, people seek treatment abroad. It has to be a service gap there, right? So, service is something we can work on with a lot of training and development, and that's something we are trying to focus on and trying to encourage, trying to build in to our culture here at Unico. So, we hope that yes, we will be able to, provide the kind of service that our patients would expect while they go abroad, anywhere it may be. We want to try and give that kind of service here at Unico Hospital. So, maybe if I just take the example of COVID, right? When COVID broke out, a lot of hospitals started developing their medical gas supply, oxygen supply. Most of the rooms didn't have an oxygen outlet, right? So those rooms can't be used for a COVID patient, correct? However, here when we did the planning, every single room has that kind of a medical gas outline, right? Every room can be converted into a standalone ICU because every room has all the oxygen, the air, the necessary medical gases, the extra electrical points. You want to connect a ventilator, you want to connect any devices. Every single room is capable of becoming converted into a standalone ICU even, right? So that's in terms of the way we have done the planning itself, is that anytime you need to convert into a high-end emergency unit, every room can be converted into that unit. So we are not only dependent on the ICU. Every room is capable of handling that level of very sick patients. And every ward can be converted into a specialized ward for handling any such medical emergencies. Number two, every floor and every ICU, we have ensured that we also have a special negative pressure, or rather an infection control room. So it's an isolation room. So in case you have very specialized, very critical cases that come in, and they are highly infectious cases, including our emergency. In the emergency ward also, we have an isolation unit. In our medical ICU, we have an isolation unit. In the surgical ICU also, sometimes we have surgical cases that can be highly infected. And therefore, we make sure we have an isolation unit there separately for them. In fact, even in our general ward floors, in our, you call them the cabin floors here, the IPD, the inpatient department, even in that floors, on each floor, we have a single room which is an isolation room. So even if we have a very sick patient who needs to be isolated for whatever reasons, we have the capacity to do that, right? We have the provision to do that. And of course, the workforce is a very important element. Our emergency management team and our clinical team, all of them are trained in emergency management, disaster management, and to upgrade ourselves. So if you need to handle these kind of very sick cases, our team is capable of handling that. Yes, that kind of a system exists. So you need to upgrade. Yes, the physical provisions are there. The clinical team is there. All this comes together. We are able to handle the disaster better. Right. So again, same thing I told you. The isolation rooms are an important element here, so that just one nurse is dedicated to the patient, and we also have the anti-room. There are certain protocols we follow here in those specific areas. And of course, if you saw at our main entrance, you saw that everyone couldn't walk into the institution. Again, that is an infection control prevention mechanism we have put in place, because we know that in Bangladesh, people love coming with family, big groups of family, right? So they would like to come into the hospital and stay in the waiting area, but all of that is adding on to our infection levels here. And a hospital is always an area where there is a higher risk of infection, isn't it? So a slightly compromised person who comes into the hospital setting is likely to also fall ill faster. So why do that? Why encourage that? So we have our systems and protocols put in place, and of course all the hand hygiene systems. Then whenever the staff work in their respective areas, they have to strictly follow the personal protective equipment protocol has to be followed. PPE we call it, has to be followed. The training and development is given in that way. So patient is also secure, the staff is also secured and taken care of. So these are multiple steps we do, multiple things we do. Very often we also evaluate the air swabs. We make sure that our infection control team, we have an infection control doctor, we have an infection control nurse who are entirely dedicated only for this. So the infection control nurse's job itself is to go to every department. Even the waste management department she has to visit, and she has to see whether things are as per protocol or not. And if there is something that is being done out of protocol, she has every right to note it down, question it, correct it, and put a system in place. Right? So right from day one, our infection control team has been made a very important part of the hospital system. So there is a microbiologist, a senior consultant who leads the infection control team, and there is a nurse also assigned with him who can visit each area and make sure our nurses, our doctors, all our team members follow the infection control protocols. In fact, even in our inpatient rooms, we have put up posters to make patients aware that if a nurse approaches you, please see whether the nurse is actually doing their sanitization or not. If they are coming to do a procedure on you, please check whether they've worn the gloves or not. Right? We are educating or making our patients also aware about what are the preventive infection prevention steps to be taken, so that the nurse does not infect the patient, and neither is the patient infecting the nurse as well. So those are small steps we have taken to, hoping that we will be able to contain or reduce hospital acquired infection among our patients.